Okay, there we go. Got it. Okay. All right. So again, we'll do number one. Okay, so which of the following is a late sign of the development of a tension pneumothorax? So A, hypotension, B, tachycardia, C, tracheal deviation, or D, dyspnea. Okay, awesome. Yeah, you guys are on the right track. So, yes, the correct answer is going to be C. Our rationale for that is tracheal deviation is due to pressure in one lung that increases due to trapped air. So, a tension pneumothorax pushes the trachea towards the healthy lung. Alrighty, so number two. Which individuals are most at risk of developing oxygenation issues? And this is a SATA question. So we have A, children under 1 years of age, B, a 30-year-old with a fractured wrist, C, a 45-year-old post-op patient who received general anesthesia and opioid pain medication, or D, a 76-year-old with a history of COPD. Okay, so the answer for this one is going to be A, C, and D. And our rationale is children under 1 are more susceptible to oxygenation issues. Patients who receive opioid medications are more likely to develop respiratory depression due to the decreased respiratory drive. And older patients with COPD are more prone to oxygenation issues due to his existing condition of COPD. All right, good job, guys. So now we're on number three. The nurse is teaching a group of nursing students about factors that can negatively affect the respiratory system and increase the risk for oxygenation issues. Problem, which of the following are recognized factors? So we have A, smoke, dust, and chemical fumes, B, a high protein diet, C, adequate hydration, or D, regular cardiovascular exercise. All right, awesome. Yeah, you guys are all on the right track. This one's not too bad. So yeah, it's A, smoke, dust, and chemical fumes. So we know that airborne irritants directly damage lung tissue. All right, number four. When administering oxygen therapy, what should the nurse prioritize to ensure the safety of the client? A, assessing the client's respiratory rate. B, monitoring oxygenation or oxygen saturation levels. C, evaluating the client's level of dyspnea. Or D, adjusting the oxygen flow as needed. Alrighty, so for this one, the answer is going to be B. Our rationale for this is monitoring the client's O2 sat levels using a pulse ox is crucial to assess the effectiveness of the oxygen therapy and to ensure that the client's oxygen needs are being met adequately. Alrighty. Number 5, a client with COPD presents with severe dyspnea and hypoxemia. What is the appropriate indication for initiating oxygen therapy in this client? A, maintaining oxygen saturation above 95%. B, correcting underlying lung pathology. C, relieving shortness of breath. Or D, preventing complications of hypoxia. Alrighty, so you guys are on the right track. For number 5, the answer is D, preventing complications of hypoxia. And we know that oxygen therapy is indicated in clients with COPD to prevent complications of that hypoxia, such as tissue damage and respiratory failure. Alrighty, number 6. A nurse is providing oxygen therapy to a client using a face mask. What is an important nursing consideration for this client? A, encouraging the client to remove the mask during meal times. B, adjusting the mask to cover the client's mouth only. C, checking the client's oxygen saturation levels every 4 hours. Or D, assessing the client for skin breakdown under or around the mask. Okay, so the answer for number 6 is going to be D. And our rationale is we know when using a face mask for oxygen therapy, the nurse should assess the skin for any irritation or breakdown due to prolonged mask use. And we know this for any type of device, right? So I had a patient yesterday at clinical and they were ventilated, um, and they had a trach. So the trach collar actually and around the neck actually has padding as well. So we know for pretty much any device that we're going to be putting on the patient, we need to always assess the skin. Alrighty, so number 7, which statement by a client on oxygen therapy indicates the need for further education? A, I should avoid smoking while using oxygen. B, I will secure the oxygen tubing under the furniture legs. C, I will keep the oxygen equipment away from open flames. Or D, I will use a water-based moisturizer for dry nasal passages. Alrighty, so number seven, our answer is going to be B. Our rationale is securing the oxygen tubing under furniture can create a potential safety hazard by causing the tubing to become twisted or pulled. Alrighty, number eight. Is this a good pace for you guys? Do you guys want me to speed it up or slow it down? Do you guys need more time to answer the questions? We're good? Okay, I'm gonna assume that we're good. Alrighty, number eight. A client with COPD has an oxygen saturation level of 80 to 84% on 2 liters per minute nasal cannula. The nurse administers the prescribed inhaled um, medicine with no improvement. The healthcare provider has not returned the nurse's page. Which other member of the interdisciplinary team should the nurse contact? A, the RT, B, the unit pharmacist, C, the nurse educator, or D, the unit nurse manager. Beclomethasone. Beclomethasone, that's what it's called. Okay. Alrighty, awesome guys. So yes, the answer is going to be A, the RT. So the respiratory therapist is going to be able to assist with any pulmonary diseases or issues that we have. Okay, number nine. The nurse receives shift report on 4 clients who are diagnosed with COPD. Which client should the nurse assess first? A client with oxygen saturation of 88%. B, a client that has just received an albuterol treatment with a heart rate of 108 beats per minute. C, a client with a serum theophylline level of 29 micrograms per milliliter. Or D, a client with a white blood cell count of 11,000 who was just admitted for pneumonia. Alrighty, so the answer for this one is actually going to be C. Um, I can see where you guys are picking A because that is a low oxygen saturation level, but we also know that patients with COPD actually run a little bit low. So 88% would be okay or normal for a patient like that. Um, so yeah, so the answer is going to be C. A safe theophylline level is actually going to be below 20 micrograms per milligram. Anything above 20 is going to be considered toxic. The ranges for the oxygen saturation. So for oxygen saturation, at least from what I learned, 80, it's like 80 to 92 is what they usually are setting at. And then Eric put in the chat the levels for the medication or yeah, the theophylline levels. All right, number 10. A client with a new diagnosis of COPD asks the nurse if the disease is terminal. Which is the best response from the nurse? A, I can call your family or clergy to come sit with you while you wait. B, do you know that smoking is the most likely cause of this disease? C, this must be very difficult. Let's talk more about how you're feeling now. Or D, your condition can be easily treated with medications such as breathing treatments. Alrighty, for this one, the answer is going to be C. This statement allows the nurse to assess the client's understanding of the disease and provides a foundation to build a therapeutic communication. Alrighty, 11. You're providing discharge teaching to a patient who was just admitted with asthma. You discuss the early warning signs of an asthma attack and you ask the patient to list some of them. Select all the correct early warning signs verbalized by the patient. So we have A, easily fatigued with physical activity, B, reduced peak flow meter reading, C, chest retractions, D, cyanosis, E, wheezing with activity, F, nighttime coughing, and G, no relief with a short-acting bronchodilator inhaler. Alrighty, guys. So for number 11, it's A, B, E, and F. So we have easily fatigued with physical activity, a reduced peak flow meter reading, wheezing with activity, and the nighttime coughing. Okay, number 12. A patient with asthma is admitted to the hospital with an exacerbation. The nurse is assessing the client's respiratory status. Which of the following findings is most indicative of an asthma exacerbation? A, wheezing, B, coughing, C, shortness of breath, or D, increased respiratory rate. Alrighty, so number 12, the correct answer is going to be A, wheezing. Wheezing is a high-pitched whistling sound that occurs when air passages through narrowed airways. It is the most common symptom of an asthma exacerbation. The other options are also symptoms, but wheezing is the most specific one. Okay, number 13, a patient with asthma is prescribed albuterol 2 puffs by MDI 4 times daily. The patient reports that the medication is not working as well as it used to. What is a nurse's best action? A, increase the number of puffs to 6 times daily. B, administer the medication by nebulizer instead of the MDI. C, teach the patient how to use a spacer with the MDI. Or D, contact the prescriber to request a change in the medication. Alrighty, the question or the answer for number 13 is going to be D, contact the prescriber to request a change for the medication. Albuterol is a short-acting bronchodilator, right? So that means that it's going to work fast to open our airways. However, it does not last very long. So if the patient is reporting that the medication isn't working, then their asthma may be getting worse and they need to make a change in the medication dosage. Alrighty. 14. The nurse in the community health center identifies which type of food is most likely to present problems for a client with respiratory difficulties. A, fruits, B, grains, C, dairy, or D, fish. All right, you guys are on track with this one. The answer is C, dairy. So we know that dairy products such as milk and cheese are mucus producing. So this may cause problems for people with respiratory difficulties since it can cause those extra secretions or thicken secretions that are already there. Okay, number 15. The nurse assesses a child admitted with a diagnosis of acute asthma. The nurse determines which observation made by the parents is significant when determining the cause of the acute asthma attack. A, my child slept on a new pillow last night. B, my child plays indoor tennis 3 times per week. C, my child takes a daily vitamin supplement. Or D, my child is allergic to shellfish. Okay, the correct answer for this one is going to be A. My child slept on a new pillow last night. So, asthma, we know, is a chronic inflammatory disorder of the airways, and allergies are one of the predominant factors that cause asthma. So, new bedding can often trigger childhood allergies, which may cause an attack to occur. And then this one was also a Kaplan question that I got um, from there. So make sure you guys are also doing your Kaplan. All right. We're going to move on to perfusion. Um, I only have 12 for this one, so it should be a little faster. Okay, so number one, what two factors are used to calculate cardiac output? And this is a SATA. Alrighty, great job, guys. So for number one, our answers are A and C. So we know that cardiac output is calculated by our heart rate and multiplying that by our stroke volume. All right, number two, an older adult patient is admitted for evaluation of dizziness and frequent falls. The nurse knows that the age-related changes in perfusion can contribute to these symptoms. Which of the following pathophysiology changes in the elderly most likely explains this patient's condition? A, increased elasticity of arterial walls and more efficient venous valves. B, a thickened myocardial tissue and calcification of the heart valves. C, increased blood volume and decreased viscosity. D, decreased resistance with improved cardiac output. All right. Awesome. So, yes, the answer is going to be B. So, thickened myocardial tissue and calcification of heart valves. So, we know that elderly patients experience stiffened myocardial tissue, calcified or fibrotic valves, and decreased arterial elasticity. So, these changes can reduce cardiac efficiency and increase resistance. Number three, which of these is considered the force? A, Afterload. Let me fix that. Afterload. B, preload. C, contractility, or D, heart rate. Alrighty, guys. So for number three, our answer is going to be C, contractility. And we also know that to increase the contractility for a patient, we're going to be using a inotrope. So something like digoxin would help also with the force or contractility of the heart. So number four, which of the following are threats to local tissue perfusion? A, increased cardiac output, B, vasoconstriction or blockage, C, vasodilation, or D, 2+ pulses. All right, so the answer for number four is going to be B, vasoconstriction or blockage. So we can kind of visualize that, right? So if we have a blockage or vasoconstriction, so we're not going to be able to have enough blood flow to our local tissue that we need to perfuse, right? So it's going to be lack of blood flow. All right, so number five, signs and symptoms of impaired coronary perfusion include, and this is a SATA question. So we have A, chest pain, B, increased O2 sat, C, hypotension, D, decreased O2 sat, E, a capillary refill of less than 3 seconds, or F, cool skin. All right, guys. So for number five, our answers are going to be A, chest pain, C, hypotension, D, decreased O2 sat, and F, cool skin. So E is not right because it's less than 3 seconds, meaning that, when we press down on the nail beds, we see that the blood return or the color comes back really rapidly, so less than 3 seconds. We know that they're being perfused pretty well, right? So if they're not, then it's going to be delayed cap refill of more than 3 seconds. Okay, number six, a nurse is caring for a client with poor lung perfusion. Which of the following complications is the nurse most concerned with? A, asthma, B, pulmonary edema, C, pleural effusion, or D, a pulmonary embolism? Alrighty, so for number six, the answer is going to be B, pulmonary edema. And our rationale for this is going to be poor lung perfusion can cause increased pulmonary capillary pressure. So this will lead to a fluid shifting into the alveoli and resulting in pulmonary edema. I can kind of see where you guys are getting D from. Are you guys thinking because it's like stagnant blood creating a clot, or are you guys thinking because they already have poor lung perfusion, there's already a pulmonary embolism inside the lung?
I was thinking the stagnant blood would create a clot, um, especially with like poor lung perfusion. I
Yeah,
didn't really think having reduced blood flow would cause edema.
yeah, I can get that. Okay. I think this was a bad question because I probably would have picked D as well. Yeah, we'll clarify.
Is it okay if I add on to this, Kate? I know I'm
Yeah,
not like,
please.
yeah,
Yeah.
guys, I just came out of clinical, so Kate was nice enough to like make up or make all these questions for you guys. So I'm just here to kind of just step in and then watch and answer with you guys. But for six, um, with pulmonary edema and like we okay, let's start off by thinking about like the fluid and electrolyte lecture. So when you think of perfusion, you're also thinking about how fluids are being pushed. So we know that it goes from the right side of the heart to the lungs to get exchanged for oxygen, and then it comes back to the left side of the heart. So when you have poor perfusion in the lungs, and there's um, blood that's getting exchanged there, deoxygenated blood being exchanged for oxygenated blood. When it says it's you're having poor lung perfusion, it's saying that you're getting blood to the lungs, but it's just not perfusing well. So what we know about fluid and electrolytes is that you guys learned about hydrostatic pressure filtration. We went over that a couple of weeks ago. So when you have this increased pooling of blood in those pulmonary capillaries, because you have poor lung perfusion, right? It's not being pushed out as easily. It's not being exchanged as easily. You have this buildup of fluids in those pulmonary capillaries, and because of the hydrostatic pressure filtration, excuse me, where it's like you have a bunch of blood in that area, it's going to push those vessels out or push the blood out of those vessels because of the hydrostatic pressure, right? Because you have all this blood building up because you're not perfusing it well, and that's is what able to is what is gonna lead to the pulmonary edema, if that makes sense. So yeah, so D, um I can see where you guys answer that as well, but poor lung perfusion can definitely lead to pulmonary edema as well. Did that
Yes,
make
thank you.
sense,
That
Kate?
made a lot of sense. Thank you,
Yeah,
Eric.
because of the hydrostatic pressure filtration, and that's like a big part of. You'll
Hmm.
see that everywhere, really. You can see it with like ascites and um, like even your lungs and lower extremity edema. It just plays into a lot of different things. So it's really important to try to connect those concepts like from fluid electrolytes into these types of things as well. I hope that helped a little. I hope it did, yeah.
Yes, thank you so much. Alrighty, guys, let's go ahead and do number 7. So, what are the consequences of poor renal perfusion? So, we have a BUN of 16, B, potassium of 4.3, C, creatinine of 2.4, or D, sodium of 139. Great job, guys. You guys know your levels. So yes, the answer for this one is going to be C, creatinine of 2.4. Our other levels are normal, and our normal creatinine is supposed to be from zero point 0.6 to 1.2. So this is elevated. Okay, number 8, a nurse is assessing a client who is experiencing poor cerebral perfusion. Which of the following complications is the nurse most concerned about? A, clot formation, B, hypoglycemia, C, meningitis, or D, cerebral edema? Alrighty, guys. So the answer for 8 is going to be D, cerebral edema. So inadequate cerebral perfusion also slows blood flow and increases the risk of stasis, which can lead to a clot formation, thrombosis. This also places the patient at risk for ischemic stroke. Did I say D? No, it's A. It's clot formation. Okay, yeah. So kind of what we were talking about. Okay, so A is, or number 9 is which assessment finding indicates decreased peripheral perfusion? A, bounding pulses, B, rapid cap refill, C, warm pink skin, or D, thready weak peripheral pulses. Alrighty, so for number 9, our answer is going to be D, thready weak peripheral pulses. So we know if the heart is weak or the blood vessels are narrowed, our flow slows down. Number 10, beta adrenergic blockers improve cardiac perfusion primarily by A, increasing heart rate, B, increasing contractility, C, reducing myocardial oxygen demand and afterload, or D, enhancing AV nodule conduction. All right. For number 10, our answer is going to be C. Beta adrenergic blockers lowers the heart rate and the strength of each heartbeat and reduces the amount of oxygen the heart muscle needs. Number 11, which organ is the most vulnerable to hypoperfusion? A, skeletal muscle, B, brain, C, liver, or D, skin? All right, great job, guys. So our answer is going to be B, our brain. So we know that the brain needs constant perfusion and oxygenation. It does not have any backup energy like the liver or the muscles do, okay? So even a short amount of time without perfusion can cause damage to our brain tissue. Alrighty, our last question. The nurse is assessing clients to determine who is most at risk for hypoperfusion. Which client is at greatest risk? A 70-year-old with a history of heart failure and dehydration. B, a 25-year-old with mild seasonal allergies. C, a 40-year-old with controlled type 2 diabetes. Or D, a 30-year-old recovering from a minor ankle injury. All right, so the correct answer to this question is a 70-year-old with a history of heart failure and dehydration. So we know that hypoperfusion occurs when blood flow to tissues and is inadequate to meet oxygen and nutrient needs. Alrighty, guys, so that is all I have for you all tonight. Um, if you guys have any questions, you can stay after the Zoom, and then I hope you guys do well on your test, study hard, and good luck.
I had a question for the perfusion
Yeah,
section.
go ahead.
Yeah, for number 8, what's the difference between